So it's frightening, isn't it, that's kind of going on. What did you make of the proceedings yesterday? What came out of it?
Well, I think the first thing to say is that footage that you've just shown of Mel Mitchell is just heartbreaking. In Australia, as rich a country as we are, that those people who've contributed so much are saying things like that. That's why we called for the Royal Commission to start with. It's just heartbreaking. But secondly, we had two bits of news yesterday. First, as you said, out of the Royal Commission, that there was no plan to deal with COVID-19 in aged care. That's just a scandal, and the Minister just wipes his hands of it. But if you fail to plan, you plan to fail, and that's what this federal government's done when it's come to aged care. We knew aged care was our biggest exposure as a country, and for the Royal Commission to hear that there was no planning is just scandalous, just mind-blowing. And then secondly, we learnt yesterday that St Basil's in Melbourne did tell the aged care regulator about their positive case. Parliament was told, our committee was told that they didn't. In fact, they did. The aged care regulator knew about it for 4 days before telling the federal department, and indeed the federal department knew about it for a week before correcting the evidence before Parliament. I want to know what the Minister knew about it and when he knew. When did Richard Colbeck know about this massive stuff-up? If the regulator knew about St Basil's and nothing was done, that's another scandal.
The government does say, I mean, to your first point there, the government does say that it has had a plan. It's had a plan since January, and it has been, say, an evolving plan given the situation that's going on with the pandemic at the moment. I mean, does that wash with you?
Strikes me as just spin cycle on overdrive. That, you know, the Royal Commission's got evidence before it from counsel assisting. The Minister's just sliding away saying we had a plan. Well, I tell you what, if the Minister wants to go and appear before the Royal Commission and tell the Royal Commissioner what his plan was, I'm sure the Royal Commissioner will be happy to hear it. They're happy to hear that the evidence given yesterday was wrong. I don't think that's going to happen.
Self-harm, as you'd be aware, is on the up. People seeking mental health services, that's up. That's on the up as well. Do you think enough is being done in this area? The government has announced extra funding. It announced last week that more money is being pitched towards mental health services. Is that enough, in your opinion?
No, a couple of points, Pete. Firstly, obviously, I welcome the expansion to 20 consultations for mental health plans in Victoria. I actually think they should apply across the country. I don't think this pandemic's mental health implications stop at the Murray River. There's people doing it tough everywhere, obviously particularly acute in Victoria. No, I don't question that. But I think just as it was done in bushfires, it should be extended much more broadly, and that 20 consultations should apply across the country. And secondly, Pete, the mental health crisis won't finish when the pandemic ends. We've had mental health challenges in this country for a long time. The government commissioned the Productivity Commission review. That's a good thing. We welcomed it. The government has the report sitting on its desk. It won't release it. And now we know the government won't respond until not this budget in October, but the next budget. That's just far too far. That's far too long away. We can do better than that. The government's got to really get its act together and release that Productivity Commission report and respond to it with funding in the October budget.
But it needs some time, doesn't it? The government needs some time to be able to enact on that, and it says that it needs 25 sitting days to be able to do that. So shouldn't it be allowed
No, that's not true, Pete.
But shouldn't it be allowed some time to be able to go through it and kind of work on it?
Of course, and I've given them that time. I mean, they've had it for more than a month. I didn't ask for it to be released the next day, the next week. We waited a month and said, OK, you've had it a month now, you can release it now. Of course the Minister needs time to go through it. Of course they need time. The budget's in October. But there should be a response in October. And it's just not true to say they have to wait those sitting days. They can release it whenever they want. That's the maximum. That's the ceiling. That's not the floor or the target. That's the maximum they can wait before releasing it. The Minister could release it today if he chose to. It's just a cop-out to sort of blame the parliamentary standing orders. Australians want to see action on mental health. We need a revolution, not an evolution. We need big change, and we need it sooner rather than later. And just kicking it off till the next budget is just not on as far as I'm concerned.
When it comes to vaccine research and development, is it doing enough? Is enough being done in this realm?
No, I don't think so. The government's put $5 million into the University of Queensland project. That's good. The Queensland government's put $10 million into that project, so the Queensland government's spending more than the federal government. But we're not doing enough to contribute to vaccine development. The Queensland project might work. I certainly hope it does, but it might not. We need to have our eggs in more than one basket. There's lots of research going on in Australia and around the world, but the federal government's just chosen one. And the result of that is that we are way behind in the queue to get the vaccine for Australians. I mean, yesterday, Pete, Japan signed their 3rd supply agreement. We haven't signed one. And other countries are signing supply agreements with vaccines which might work. They're taking risks, they might not, but they're taking the appropriate risks to say, well, there's somewhere between 150 and 200 vaccines under development in the world. We know that vaccines have a 96% failure rate. Most of them don't make it. So if we're just backing one, there's a fair chance we're not backing the right one. I certainly hope we are backing the right one, but it's a huge punt with the help of Australians.
But
so
that
we
would
should
be
spending more on vaccine development.
That would be too expensive, wouldn't it, to be able to sign up to all of the different trials? As you mentioned, there's 160, 200 different trials taking place around the world.
Yeah. Nobody said we should fund all of them, but I'm saying we should fund more than one, and I'm saying we should be entering into supply agreements with firms that are developing other ones. As I said, Japan signed their 3rd agreement yesterday. The United States has ordered millions and millions of different vaccines. The United Kingdom's spending a lot more than we are. Germany's really doing a lot as well. Now, $5 million for one trial is just really not going to cut the mustard when it comes to vaccine development and ensuring that we get our fair share of the vaccines when they're distributed around the world. Scott Morrison held a press conference and said, whoever gets the vaccine has to share it. Well, I'm sorry. I mean, around the world, the pharmaceutical companies and the other governments aren't saying, oh, look, Scott Morrison's held a press conference, so now we have to think about Australia. It doesn't work like that. You've got to be in the discussions. You've got to be signing the deals. You've got to be funding the research.
Just finally, Chris, we've been running this video all morning. It was published by the Herald Sun this morning. It basically shows the security company who was in charge of hotel quarantine. It's kind of self-congratulating itself. It's quite a bizarre video, to be honest with you, but it basically shows that they had less than 24 hours to set up its own program. I'm not sure if you've managed to cite it yet, but what's your view of it?
I had a quick look at it, Pete, but I mean, obviously everybody knows this quarantine was put in place at very short notice. The Prime Minister made the announcement that there'd be compulsory quarantine in hotels, and it happened 48 hours later. And obviously that was very fast-moving for everyone. And obviously most of the burden, frankly, went on New South Wales and Victoria, who take most of the international arrivals into Australia. Quarantine, everybody recognises, is a federal responsibility, but the states did take that organisational responsibility at very short notice. I think Dan Andrews is appearing before a parliamentary committee today. He's taken responsibility as the Premier for any shortfalls. We'll need to see, obviously, what evidence the Premier gives. We'll need to see where the judicial inquiry goes. Obviously, there's lessons to be learnt here, but the fact that people were moving very quickly is not a surprise to me. To be fair to everyone involved, federal, state and the private sector, it was done at, I think, as I recall, 48 hours notice to say we'll be putting in place compulsory hotel quarantine, so people were moving quickly. OK.
Shadow Health Minister Chris Bowen, appreciate your time this morning. Thanks so much for joining us. We'll talk to you again soon.
Great pleasure.